Hello guys, today we're going to talk about the dry socket. So dry socket it is the painful condition after extraction of the tooth. And if you're new in this channel, please like and subscribe, that would be highly appreciated. And here's the ideal picture of dry socket. So this is also known as painful socket as there is extreme pain, and it is also known as alveolar osteitis as there is the inflammation of alveolar bone, and it is also known as localized osteomyelitis as the inflammation remain localized, that it doesn't spread other parts. Also it is known as necrotic socket alveolitis as there is a necrosis of alveolar bones. Now let's see the definition of dry socket. So it is the focal osteomyelitis in which the blood clot disintegrate with production of foul smell, pain, but no suppuration. So in dry socket, there is the inflammation of bones and the blood clot which is formed after the extraction of the teeth. It it get washed away or it disintegrate, and there is a production of very bad smell, and there is also extreme pain, but there is no pus formation. So this is the definition of dry socket. So this is the most common and painful complication of extraction. Let's see the etiology of dry socket. It could be caused by traumatic extraction. So when you manipulate the tissue during extraction, or when you use a lot of instrument during difficult extraction, it damages a lot of surrounding tissues and gums. As a result, it may lead to poor wound healing and leads to dry socket. Also, smoking after extraction can causes dry mouth and also poor wound healing and leads to dry socket. Also, excessive rinsing the mouth. So when you frequently rinse the mouth after extraction, the blood clot that is formed get washed away too. As a result, it doesn't heal faster and leads to dry socket. Also, oral contraceptive uses can lead to dry socket as these medicines can increase the level of estrogen hormones, and this hormone can lead to poor wound healing. Also limited blood supply. So when you have less blood supply in that area, it leads to poor wound healing and leads to dry socket. Also excess use of vasoconstrictor in LA. So when you use excess vasoconstrictor like adrenaline during giving of local anesthesia, then it may lead to dry socket because vasoconstrictor, they constrict the blood vessels and limit the blood supply to the wounded area. Also pre-existing pericoronitis. So when you have pre-existing pericoronitis, that is inflammation of the gums around the third molar region, then it may lead to dry socket as a result of poor wound healing. Let's see the pathogenesis of dry socket. So according to the Burns, there is a trauma during extraction, and this trauma causes release of chemical mediators, and this chemical mediator causes activation of plasminogen into plasmin. So this plasmin causes fibrinolysis and clot lysis. So this fibrin and clot, they are like the protective layers. As they get break down, there is an exposure of the bone. Now according to the netizen, there is anaerobic infection after extraction of the tooth, and this process causes fibrinolytic activation. So there is activation of fibrinolysis, and that is plasmin get activated, and again this plasmin causes fibrinolysis and clot lysis. So the protective layer, that is fibrin and clot, get break down and there is exposure of bone. Let's see the clinical features of dry socket. So this is extreme painful condition, so there is extremely pain, and it occur more in female than in male because female has more estrogen hormones, and also it occur more in mandible and than maxillary third molar because in mandible there is a less supply of blood, and also food are stocked more in mandible when compared to maxilla, and it develops after 2 to 3 days of extraction. So this dry socket develops after 2 to 3 days of extraction. The bone is exposed and there may be fragments of the bone. So in dry socket, the bone can be seen as the protective layers, that is blood clot, are washed away, so the bone is exposed, and also there may be fragments or pieces of the bone. Also there is a foul odor, that is very bad smell coming out of the area, and no suppuration. Although this is a painful and inflammation condition, there is no pus formation. And there is a local swelling and lymphadenopathy, that maybe mouth or area may be swollen, and also the lymph nodes around it are swollen. Let's see the management of dry socket. So first, irrigate the socket with antiseptic to keep the socket clean. So this antiseptic helps to keep away the microorganism from that area. Also, local rinsing with antiseptic and dressing iodoform gauze with zinc oxide eugenol. So you can rinse with antiseptic. Also, dressing with iodoform gauze with zinc oxide eugenol. This provide relief and soothing effect. Also, dressing is changed every day, and hydrogen peroxide mouthwash can be also used to keep the mouth clean, and intrasocket medication can be also used, such as dextranormal granules, eugenol. Also, antibiotics are used in extreme cases if there is an infection, such as tetracycline, metronidazole. So that's all about the dry socket. If you like, then subscribe to my channel and feel free to ask the question in the comment sections.